So we will begin the session, and a warm good evening to all of you. And today we are celebrating the 72nd Republic Day, and I wish all proud Indians a happy Republic Day. So now it is our responsibility to uphold our integrity, liberty, equality, and also raise our country above all barriers. So let us all join hands together for this. And before going ahead, let me introduce myself. My name is Bindu Valur, and I am the Manager Academics Outreach of Ahalia Group of Academic Institutions, Palakkad. And in this panel discussion is on COVID-19 and its vaccination and thereafter is organized by Ahalia Forum, which is an initiative of Ahalia Group of Academic Institutions, along with Unnat Bharat Abhiyan and Institutes Innovation Council units of Ahalia School of Engineering and Technology. Ahalia Group, and before going more about the program, briefing more about the program, I would like to give a brief about what Ahalia Group stands for. Ahalia Group of Academic Institutions is an initiative of Ahalia Health, Heritage and Knowledge Village, Palakkad, which is headquartered in UAE. And I'm glad that our chairman, Dr. V.S. Gopal, is also present among us. Welcome, sir. And here we are actually a conglomerate, one of the biggest conglomerates in Kerala. We have staunch presence in education sector, healthcare, media and publishing, finance, alternate energy, organic farming, and we are venturing into a lot of other sectors also successfully. So we are kind of a growing company, and we also believe in adding value to the society, not just profit making. So profit making is not just the motive of Ahalia Group. We also want to give back to the society, and we believe in sustainable development. And I welcome all of you to visit our Ahalia campus Palakkad once, because that's a place where you can learn how a corporate group can add value to the society at the same time, protect the environment, and how a sustainable development can be done in a place called Palakkad. So I warmly welcome all of you to our campus one day. Now, before going ahead with the program, I'll just brief you through how the program is going to go about. So this panel discussion has 4 guests, and initially we will begin with a welcome address by Professor Lakshmi Suresh. After the welcome address, the Director of Academics, Dr. P.R. Mahadevan Pillai, will initiate the presidential address. After the presidential address, we will introduce all the guests to the participants. This is for the benefit of the participants. They should know whom they are interacting with, who are going to give them thoughts and ideas about this. So all the guests will be introduced in a go. After the introduction of the guests, Dr. Amar S. Fettel will give the inaugural address, and he will also share his thoughts and ideas. Then we will move on to Dr. Padma Kumar B. Sir will give us idea about the clinical part of the vaccination and the COVID disease as such. And then after that, we will listen from Dr. Prem Narayan regarding the endocrinology implications of COVID-19. Then we have our own Professor Roshan Sanu. He is a COVID survivor. He will brief you through his experiences. And after all these talks, we will open the forum for the participants to interact. The participants can put all their concerns and queries and doubts in the chat box, which I will read out. And the panelists, the guests, can give their views on that. So this is how the program is structured. So now I welcome Professor Lakshmi Suresh. She is the office bearer of Institutes Innovation Council of Ahalia School of Engineering and Technology. She will offer the welcome address. I welcome you, ma'am.
Thank you, Bindu, ma'am. Hope I'm audible. Okay, thank you. Good evening, everyone. As we all know, we are going through a tough period during this pandemic situation, and the only hope that touched our lives was the launch of vaccine. But again, there are some confusions and fear among the common people. So Ahalia Group of Institutions are always trying to work on the socially relevant issues. And on this context, we are organizing a panel discussion on COVID-19 vaccination and thereafter, which is jointly organized by Unnat Bharat Abhiyan and Institutions Innovation Council. It's my privilege to welcome our chairman, Dr. V.S. Gopal, sir, to this function. Welcome you, sir. I would like to welcome Dr. P.R. Mahadevan Pillai, sir, Principal, Ahalia School of Engineering and Technology, and Director, Ahalia Group of Academic Institutions. Welcome you, sir. Next, I would like to welcome Dr. Krishna Kumar Kishore, sir, Vice Principal of Ahalia School of Engineering and Technology. Welcome you, sir. It's my privilege to welcome our eminent panelist for this discussion. I would like to welcome Dr. Amar S. Patel, who is the State Nodal Officer for COVID-19, Government of Kerala. Welcome you, sir. I would take this opportunity to welcome Dr. B. Padma Kumar, sir, Professor in charge of COVID-19 ICU, Government Medical College, Alappuzha. Welcome you, sir. And it's my pleasure to welcome Dr. Prem Narayan, Consultant and Head, Department of Endocrinology and Diabetology, Ahalia Diabetes Hospital, Palakkad. Welcome you, sir, for this discussion. Next, it's my pleasure to welcome Professor Roshan Sanu, Assistant Professor of Department of Computer Science and Engineering, Ahalia School of Engineering, my colleague who is also a COVID-19 survivor. Welcome, Roshan sir. And I would also like to welcome Bindu ma'am, who is a moderator of this program, and also Prija ma'am, who is the in charge for Unnat Bharat Abhiyan. Last but not the least, I would like to welcome all the eminent participants for this panel discussion. I hope everyone will get an insight about the COVID-19 vaccination and thereafter. Thank you all. Welcome all to this program. Thank you.
Thank you, Lakshmi ma'am. Now I invite Dr. P.R. Mahadevan Pillai to offer the presidential address. Let me give a brief about him. He is the director of Ahalia Group of Academic Institutions, India. He is also the principal of Ahalia School of Engineering and Technology. Prior to this, he was a professor of NSS Engineering College, Palakkad, and almost for a decade, he was the Dean of Faculty of Engineering of University of Calicut. And he has served in many, like as an advisor, as a consultant, and in many government institutions. So I welcome you, sir, to offer the presidential address.
Thank you, Ms. Bindu, for the introduction. I'm very happy to note that the chairman of the Ahalia Group of Institutions, Dr. Gopal Vies, has joined us from UAE. Truly speaking, he was the person to deliver the presidential address for this program, but since we are not sure about his presence, I have taken over that charge. I'm very happy that he has joined us. I also hope that he will speak some few words to us, either in the beginning or whenever he feels like. I'm also very happy that after a decade, I'm seeing Dr. Amar Patel. I think he has turned a bit old in these 10 years. And of course, we have got two more good panelists, Dr. Padma Kumar and Dr. Prem Narayan, and my own colleague, Mr. Roshan Sanu is also there. I'm very sorry that in between we had an interim break. You know that in many of the northern states now it has been broken. And I had a break of around 10 minutes, and the Bindu also had a break. So some of the participants who wanted to join in that period couldn't join. I think they will come back and join. They were not aware that they couldn't be admitted. There was a break of connectivity because this Republic Day is seeing something which don't befit a republic. So maybe because of that reason, the connectivity would have gone. And of course, COVID is something which threatens everyone. I'm not a direct sufferer from COVID, but I'm an indirect sufferer because my son got COVID twice. He first got in May, and then after 6 months, he got again in December. So the myth that COVID will not come to those who have got antibodies in themselves is only a myth. It can come again, maybe the same strain or a different strain. And I've been definitely affected by the occurrence of twice a COVID in the same family, but it is happening in many places in India. So we will discuss all these things by our experts who are here. Dr. Patel has been in charge of this for a long period, and even in community medicine, his service has been tremendous in the state of Kerala. And he takes very less rest time, and he is always after such social activities. And of course, he will also be able to explain us about the activities and the orientations which are being given to the medicals in the state for taking over these problems. And of course, I'm told that Dr. Padmomar is in charge of the COVID ICU, so you would have seen a lot of cases in that. I'm not involved into the medicine part of it, but there are so many vulnerable groups, and also I'm pained by the fact that the highest incidence rate is in Kerala. Whatever is the reason, we can explain, something goes wrong. As per yesterday's statistics, we are closing the limits, and even now in the world over, our incidence rate is very high. So I think the medical experts will throw light upon them. I'm not taking much time. I think before the program starts, I request honestly our chairman of the Ahalia group, Dr. V.S. Gopal, to say one or two words so that we can just listen to him before starting the program. Over to you, sir.
Chairman, sir.
Yeah, thank you and welcome to this unexpected meeting. In fact, I had something other. I was not planning to join, but while going through the list of participants and organizers, I thought I should attend because most of the participants here are Ahalians and we have a big thing to contribute to this initiative. So, first of all, I thank for my colleagues who at Palakkad. By the way, I'm joining from Abu Dhabi. I'm at my home in Ahalia in Abu Dhabi. For the last 1 year, I am at home and working from here. So I'm missing Palakkad terribly for the last 1 year. I used to visit every fortnight. Because of the COVID pandemic situation, I am stuck up to home. So I don't prolong much. I thank my colleagues who organized this program, which is the need of the day. There are a lot of things which we talk about COVID-19 pandemic. It is something like the blind people want to see the elephant. So we are in a confused state. Some people say elephant is round, some people say elephant is like a pillar, some people say elephant is like a threat. So pandemic, the COVID pandemic is still a mirage, and it's also a dilemma for the entire medical community world over. So also is the vaccination. There are so many confusion about the vaccination right from the beginning. And we are, for your information, I had my jab almost 3 weeks back. The people in India, they are too much concerned about the vaccination, especially in people in Kerala, they are too much suspicious about getting the jab or not. But my personal opinion and experience is that we should. I mean, it is better not to take, especially for the vulnerable community. If you go through the statistics of the COVID-19, because what we have now in our hand is certain statistics, certain figures. Nobody is in a position to make out certain rules or certain protocols for the COVID-19, either with regards to etiology or the management. So whatever we have, because it's a relatively new disease, and the medical community still feel it is still early to formulate certain protocols for the management of the COVID-19. What we have is the experience of the veterans who fought the disease for the last 13 months. Other than that, we don't have any streamlined or any established principles in the management of COVID-19. The observation what I have done from my limited experience as a physician, as a person with common sense, is that whatever be the morbidity and whatever be the epidemiology of the disease, one thing is sure: if you go through the statistics of Kerala, for example, we have had numbers of disease starting from 1,000 to 14,000. Now, in the last two months, we have cases between 4,000 to 7,000 almost every day. But the number of people who are dying is limited to between 25 to 30. I don't know, many people have observed this situation. What does it show? That means whatever be the number of people infected and whatever be the positivity rate in PCR testing, the morbidity rate is standing still, because the number of people who are succumbed to that is between 25 to 30. That means even if you have whatever is the protocols, the precautions you take, whatever be the precautions you are taking, the risk is same for the people who have got comorbidity. So this is something this is a very important point for to observe and to follow. I mean, these people, we take the three protocols like hand washing, social distance, and wearing mask, the precautions, so that we can keep away the illness for certain period, and also we can limit the spread of the disease. But once you get infected, the morbidity or the mortality is same. The risk for the risky group is same, irrespective of the infectivity. So this is this very well points out the importance of the protocols to keep the special care for the people who are having the comorbidities. Among the comorbidity in Kerala, diabetes stands in syndrome. Diabetes, obesity, and other related diseases like COPD, the chronic obstructive airway disease, renal failure, and compromised immunity for patients suffering from malignancy or these things. So these six comorbidity factors, people who have these six comorbidity factors, the risk is equal. The risk is same. So that is so here lies the importance of giving stress for the people who have got any of these comorbidity. That is the relevance of today's our meeting, because our meeting is attended by expert COVID-19 managers, and also we have people who have experience in diabetes and other lifestyle diseases. So this stress on management of comorbidity, that will be the important factor in the coming days as far as management of COVID-19 in Kerala is concerned. So having said, I invite all of these people to today's session. I hope we will have a very enlightening session. Once again, I thank you for having here with us and be a participant in this COVID-19 session. Thank you very much.
Thank you, sir, and thank you very much. And we're all glad to see you among us today. Now, let us move on to introducing the guests. I will take the privilege to introduce Dr. Amar S. Patil, and then I will have a few of our students introduce the other participants, other guests. So, as I have not by heart on your profile, I will have to read through that, sir. Now, let me introduce Dr. Amar S. Patil. Dr. Amar S. Patil is presently the State Nodal Officer for COVID-19, and he is also the State Nodal Officer for the Adolescent Health of National Health Mission of Government of Kerala. Since 2016, he was a Senior Consultant Pediatrician of Kerala State Health Services, and from 1991 onwards, he was handling the responsibility of District Physician in AIDS Management. He's a consultant and resource person for various government institutions, and where he was dealing with adolescents' health, infectious diseases, crisis control. And he is supported with institutions like Kerala Institute of Local Administration, Academic Staff College of University of Kerala, Nehru Yuva Kendra of Government of India Initiative, Army Hospital Trivandrum, Southern Air Command Trivandrum, Rajiv Gandhi National Institute for Youth Development. These are a few, to name a few. He was closely associated with All India Radio, Akashvani Anantapuri, Doordarshan Kendra, in discussing health-related topics and thereby creating awareness among the community. In 2012, he was posted as National Nodal Officer for Adolescents' Health, Department of Health Services, Government of Kerala. Dr. Patil was posted on special duty and working as a State Nodal Officer for H1N1 and other public health emergencies of international concern. He is also a member of State Advisory Committee, SCERT. And along with that, he was advisory committee of Kerala Institute of Local Administration, academic staff in College, University, Kerala, and such. And he's also contributed and designed scores of training programs and modules for various national and international agencies like Baby Friendly Hospital Initiative for UNICEF, HIV/AIDS Management Program, Health Services for Government of Kerala, RCH Development Program, KIGA. And these are again a few, a name of few. He was the former secretary of Indian. Okay, I'm sorry for the interruption. He was the former secretary and former president of Indian Academy of Pediatrics, Trivandrum, and for his meritorious service as State Nodal Officer H1N1 in the effective control of the pandemic in the state, Government of Kerala declared good service entry for Dr. Fettil. We welcome you, sir. And now I welcome our student, Mr. Arjun, to introduce our next guest, Dr. B. Padmakumar. Mr. Arjun is the first year student of Ahalia School of Engineering and Technology. Arjun, are you there?
Yes, ma'am. Am I audible?
Yes, you're audible and you're very much visible also. Please go ahead.
Good evening, everyone. I take this opportunity to heartily welcome Dr. B. Padmakumar sir to this panel discussion. I will say a brief about Padmakumar sir. As we all know, he is a professor of medicine at Medical College, Alappuzha. He is a professor in charge of COVID-19 ICU. Sir, he is the recipient for the Best Doctor Award from the Government of Kerala in 2010. He has authored about 25 books in health science. Sir wrote about the first book about COVID-19, Coronium Nuru Chodyangalum, which is published by the State Institute of Languages. I humbly welcome you to this event, sir.
Thank you, Arjun. And now I welcome Ms. Nityashri, first year student of Ahalia School of Engineering and Technology, to come forward and introduce Dr. Prem Narayan to the participants. Nityashri, are you here?
Yes, ma'am.
Yeah, please go ahead.
A very good evening to all the dignitaries, guests, teachers, one and all present in this platform. It's my privilege to have been asked to invite the guest of honor, Dr. Prem Narayan, who is the consultant and head of Department of Endocrinology and Diabetology, Ahalia Diabetes Hospital, Palakkad. Now, speaking about this dignitary's educational background, he has completed his MBBS from the prestigious Government Medical College, Kottayam, his MD from the Government Medical College, Trivandrum, and his Doctorate of Medicine in Endocrinology from the respected Banaras Hindu University, Varanasi. Now, he is the most cordially invited speaker at various national and regional conferences. He also has immense mind-blowing publications in various national as well as international journals. He is also the member, founder, and secretary of the World Integrated Society of Diabetes, Endocrinology, and Nutrition. Moreover, he is also the member of Endocrine Society of India and Diabetic Society of India. I once again wholeheartedly welcome you with immense exultation to this panel discussion, sir. Thank you.
Thank you, Nityashri. Now I welcome Ms. Let me just enter a few participants. Okay. Now I would like to welcome Ms. Aishwarya S., who is the first year student of Ahalia School of Engineering and Technology, to introduce Professor Roshan Sanu to the audience, to the participants. Aishwarya?
Ma'am, Anugraha.
Oh, sorry, I'm sorry, I missed your name. I'm sorry, Anugraha. I'm very sorry for that.
Okay, ma'am. Good evening, everyone. I take this opportunity to welcome Professor Roshan Sanu, the Faculty of Department of Computer Science, Ahalia School of Engineering and Technology. He is associated with ASSET for more than 6 years. Roshan sir is the NSS Program Officer of ASSET and he led many social relevant activities. He was infected by COVID-19 and recovered. I welcome sir to this panel discussion and share his experience with all of us. Thank you.
Thank you, Anugraha. Once again, I apologize for taking your name wrong. Now, I welcome Dr. Amar S. Fettil to offer the inaugural address, at the same time convey the thoughts. And there are a lot of concerns in our mind regarding vaccination. Though we all know that we have to take the jab, but we still are skeptical because there are so many news that that is being spreading around. So we want to hear from the horse's mouth how things are going around.
Thank you so much, Ms. Bindu. This is a great honor for me to be here with the esteemed audience and the seminar organized by Ahalia Group of Institutions. Respected Mr. V.S. Gopal, Chairman of the group, Principal Dr. Mahadevan Pillai, Dr. Krishna Kumar, Dr. Padmakumar, my old friend, Dr. Prem Narayanan, Dr. Roshan Sanu, other distinguished faculty members, and dear students of the institution. Good afternoon once again. As Bindu had just mentioned, this whole program is about COVID and COVID vaccination because that seems to be the hot topic of the day. And the first maybe solid ray of hope that we have in this, you can call it an epic battle, because I think mankind has never fought anything of this sort on this scale ever before, except for maybe wipeout or knockout pandemics like smallpox, where the fight element was not there. People were succumbing, but here now we are putting a big fight. So it's in that context that vaccination has a big role. And our entire efforts have been so dramatic and wonderful to look back upon. 1 year is not a long period to look back upon, but there are a lot of things that we will never ever forget. So I would have a small set of slides, and I would like to present a small maybe narration or a story. So I hope I can present that now.
Yes, sir, you can. You can, sir.
Is the presentation visible?
Yes, it is. It is coming up.
Yeah, clear enough?
Yes, very clear.
Thank you. So it's as I said, I'll be talking about the vaccination campaign. I will keep it very short and snappy, hopefully, and so that we will have time for discussion, and the other esteemed participants of the panel, the experts, will have time enough to talk. So the whole thing maybe started off. It's a very short span of time, end of 2019 and the entire period of 2020, and now we are into 2021. So this picture has become the scariest picture that I think mankind has faced. This little thing, so small, so infinitely small, has held the globe to ransom, so to speak. It has destroyed the hopes and the lives of so many people, the hopes of so many families. It has caused incredible expense at the cost of other important sectors that we today need as essentials. It has put a limit on freedoms and everything. Entire life as we know it has changed in a very short time. And we are now into what we call the new norm. That is the name that we call it today. And that is on one end. So 2019, 2021, 2019, 2020 and 2021 on one end. And then we will go about nearly 250 years or so back when this gentleman, whose name medical science will never forget, for that matter, nobody looking at the history of the world will forget, because Edward Jenner, the astounding physician of that time, and long back without any modern aids, he devised the concept of vaccination to a perfection perfection for the time. And you have here in this picture, he's doing this process of vaccination on one little kid called Phipps, the son of a gardener who worked with him. In fact, later on, he vaccinated his own son, and this was done against cowpox. So this was in 17th of May, 2017. 17th of May, 1796. Sorry, 17th of May, 1796. So long back. So one in 2019, 2021, and one in 1796. Long span there, and his process or the thought was acknowledged as one of the heartbreaking events, and he has been credited with saving so many countless lives. This process of vaccination, so it is certified in all the testimonials of the time and therefore. And that process which he started off has gone far ahead into what we now call rocket science. That sort of name we call it, because it has become so advanced and so superfine perfection, so that the products that they are designed in vaccine research and development are need to be so safe and so effective, which is a very delicate combination to get, very effective and very safe, and dealing with germs of all sorts. So that is vaccine research. And 2019-20 or 2020, the vaccine research went into top gear because we had very little time, and the pandemic was raging and devastating the whole globe. So the vaccine research people had to do their job double quick, and they rose to the occasion. And within a astoundingly short time, they have devised what we call several kinds of vaccines, which of different methods, which work in different methods. These were all put to trial, at the last stage of which there were small and then large scale trials using human volunteers who willingly participate in the trials. And once the certification of all that went on and the human trials were successfully completed, efficacy could be judged. And finally, now the product was ready. So now we have quite a few manufacturers in cutting edge in the field who have developed products which can be used for it. So that is the offering that the vaccine research industry or the field has given to the world. So this gift has been gifted, this vaccine has been gifted to us there. Now, producing a vaccine is one thing, but mass production is another thing. So there's another achievement that this sort of delicate stuff could be mass produced in incredibly sophisticated plants. They were mass produced on the scale of millions of doses, which will be needed over the world. And these doses were then, they were produced in such numbers and they were transported to different countries. And now India has started manufacture, and we have 2 manufacturers into the manufacturing fields who are able to produce mass supplies. So with that courage that we have the stuff in hand, we have it here, we have it in our country, and we can be proud of having it inside our own country. So we have now reached that stage. Naturally, the next thing is that the government of India now, with this state of readiness, has taken decisions which need to go forward. And these decisions was one of the major reasons that the entire country will be offered the vaccine. But you know that this is a hard task. Offering such a vast country, a huge subcontinent like India, vaccine is a very, very tough challenge. So there were so many meetings and planning sessions and everything went on through the day and night, intensive groups, so many millions of brain hours there. You see very senior people and experienced people in the field all sat together for hours and days and weeks on end. And finally, the consensus arrived that we will first prioritize and immunize the health worker teams, because we know that what victory we have gained against COVID in the short 1 year, that victory is based on the fact that health workers are at the forefront. They have been sacrificing their life, their time, their families, everything for the sake of saving lives. So this priority comes naturally that they will be the first people to be vaccinated. And then for this thing itself, we know that it has been done with a vast amount of perfection, a huge amount of trainings for all kinds of stakeholders involved in this process. Training for health staff and all kinds of people. Cascades of trainings have been going on down the line, again on a day-night mode. And these trainings have often taken the form of virtual trainings, because now we know that getting into gatherings is not very advisable most of the time. And then, so once this was on the way, then we also parallelly looked at material and logistics, looking at things whether we are ready. So things like walk-in coolers, things like large ice line refrigerated stock to maintain stocks very cold. There's something called cold chain, where from the factory to the human body, it has to remain at a temperature of 2 to 8 degrees centigrade, not more and not less. And so these are all components of what we call the cold chain, cold boxes, large and small cold boxes. The very familiar vaccine carriers, which our health workers transport the vaccine into their sites where they do the process. And the ice packs which we use to keep vaccines cold inside the vaccine carriers. There's a special kind of syringes which are called auto-disabled, so that once the syringe is used, it can't be used again by anybody. It disables itself. You cannot reload it again. So auto-disabled syringes. So all these things came into the field, and they were all gathered. In fact, talking of syringes, 14 lakh new syringes came into the state, 12,000 ice packs, 1,800 vaccine carriers, and 20 big ILRs. A lot of things came into the state newly. To Kerala, we in India, we have a very robust immunization system, and Kerala has fine-tuned that one. So we have such a strong system. All these have come on top of that. So we made sure we are doubly ready. And when such a huge event goes on, we need to monitor things. Here also we had a forerunner called EVIN, it's an Electronic Vaccine Intelligence Network run by the Government of India and National Health Mission to keep a tab on vaccine movement and stocks and administration. And out of that was born the new baby COVID. So it is winning over Corona or winning over COVID, that is COVID. And it went into an app format and an application format with numerous stakeholders able to log in with their own identities and all that. And this system keeps a tab on vaccine movements, who is administered, administration certificates, adverse events, everything is captured in the system. So that's how such a mammoth event is being run effectively. In fact, other things that we plan very meticulously were the vaccination sites, where the vaccination will go on. It's just like a polling booth, where you have a waiting room in the initial period, initial part, then you have a vaccination room, then a last room to observe the people for half an hour. There are the first vaccination official, second vaccination official, the third person, the vaccinator, and the fourth and fifth vaccination officials. So they all have well planned jobs, and the structure, the layout, everything was so meticulously planned at national and at state level. We have done it on such a beautiful way that many people can't believe what they see when they go to the vaccination sites. Information, education, and communication machinery to convince and motivate people very necessary, because I heard a comment earlier that people will have hesitation. That's only natural. There's something new coming to the field. It's something so new that it's only unusually people don't have doubts. So to counter the doubts and to give the right messages, the IEC machinery, the state health department, and the Ministry of Government of India also has been in full power now. Adverse events for following immunization, that is any kind of reactions or even minor things like just pain, swelling, irritation, having fever, everything is entered in the system so that we can keep a track on what is simple, whether anything unusual is going on. So that is part of the routine system for vaccination, nothing specific for this one. But that's a routine of any vaccination system in the country. So now already study, the race is going on, and we now are the final part. So we had to test the system. So all over India, there were trial runs where everything was done. The whole vaccination process was mimicked. The entire process was done in a sort of mimic mode, or a, what we call trial mode, so that you could be doubly sure that everything is going to run perfectly. So the trials were also completed, the dry runs were completed, and then there was waiting period. So what did we wait for? The vaccines had to come. Finally, that day also came, 16th of this month, January, the vaccines arrived in Kerala state. They started dispatch from Pune Serum Institute to the vaccine stores of Government of India, and the first consignments reached Trivandrum and Kochi. So the vaccines landed by flight. In fact, these flights were even given top priority, like landing first TNFs was a landing queue. The vaccine transport vehicles of the Department of Health Service were allowed to go onto the tarmac to collect the vaccines from there, load, and then rush back to the regional stores. So these things were done in military style. So the loaded vaccine inside, this is all refrigerated vehicles. So these would rush back to the regional vaccine stores, and similar smaller vehicles would transport them back to different parts of the state, the different health institutions for maintaining the local stock. So this sort of chain of transport also was monitored very tightly and done in a very perfect manner. And then this picture has now become famous. The process was launched, and so the first person to receive it in India was a health worker belonging to All India Institute of Medical Sciences, Delhi. He received the vaccine, and I think the next person to receive the vaccine, the historic thing in India, was the director of the prestigious institution, All India Institute of Medical Sciences, New Delhi. So that is Dr. Randeep Guleria there receiving the vaccine. So with that start, then the whole country went into the actual vaccination process mode, and all health workers started receiving. Very systematic process. Vaccination sites would give 100 people a vaccine a day. Each person would be observed for half an hour, and the whole thing would be done with a software application, uploading details, checking Aadhaar card, checking authentication, and then giving the green signal for the vaccinator to inject, and then the waiting period and observation period. And finally, a certificate that you have received the first dose. So this happened everywhere, and here also it's been happening with clockwork precision in the state of Kerala. We have 136 sites now, but we are scaling up to complete the process faster and faster. But at the same time, our premium is safety and carefulness and precision. So we are doing it in a very controlled mode, but we are going very fast. Comparing these two vital processes to finish the whole thing in quick time. And our target is that every health worker, initially, we will go for health workers. Once the health workers are over, this will include the Anganwadi workers and the Asha workers. Then we will go into the teams of revenue people, the police and other frontline workers. Then we will go for people, we will make it available. Government of India will make it available for people over 50, that too with a priority for those over 60. Then once the entire segment over 50 is over, then below 50, those with some disease like diabetes or comorbidities, what we call them, they will be given priority, and after that will come the lower priorities. So that is how the mechanism runs. So I've been talking about the mechanism of vaccine administration. So me too, I was also there, and I also received the vaccine on last day I was there and received on 21st of this month. I also received the first dose of vaccine. It was perfectly okay. We all expected something. I had a very mild feverish feeling. Yeah, I couldn't call it a fever, so mild and but some people had more severe fever. Some people had body aches and all that. But everything recovered within usually 24 hours and all that. The most that people took was a dose of paracetamol, one or tablets of paracetamol. That was it, and people were all okay. And this only shows the body is working and the immune system is the vaccine and the immune system are interacting, and your immunity has starting to be boosted. That's the sign that fever and other systemic what you call mild symptoms indicate. So with that very fast travel through the entire story, it's a long story, it's a vast story, but since time is limited, we have to keep it short. So thank you very much, everybody, for the opportunity that you've given me to share this little story with you and to say give you all an indication of what the whole thing was like. So thank you very much once again, and I think we will be going to the next person first.
Thank you, Dr. Fikar. And we will save all the questions to the end. Now we will listen to all the guests first, and then the participants, after all the guests have spoken, participants can put their queries in the chat box. Now let us give the baton to Dr. B. Padmakumar. Sir, we have in the introduction itself, we have heard about his profile. He has been treating COVID from the day one. Maybe when it came to Kerala, maybe from that moment he's been active in clinical side of administering COVID, and now so he will have a lot to talk about this. So now I invite Dr. B. Padmakumar to give us an insight on and share his experience on handling this disease and how he kept it in check.
Thank you, Bindu Madam. Good evening to you all. Respected Gopal Sir, Mahadevan Pulla, senior faculty members of Ahalia Group of Institutions, and my fellow panelist, dear Amar Fetli, and Dr. Prem Narayan, and Dr. Professor Roshan, and my dear students. First of all, I would like to congratulate this Ahalia Group of Institutions for organizing such an excellent program. About 128 participants have already joined in this webinar, and it is going successfully, and I would like to congratulate this Ahalia Group of Institutions. And I am also thankful to the organizers for giving me this precious opportunity. And to my part, Dr. Amar has beautifully narrated the story of this vaccine journey. And I think my duty is to discuss the clinical aspects of this COVID and how we are managing these patients in our hospital. Such clinical aspects, I think I will discuss in a lighter sense, because most of the participants are students. They should understand the fact also, and after that we should have a very beautiful discussion. That is the main intention of this program, I think. So coming to the COVID story, it is exactly about 1 year back. The first case in India was reported from Kerala, and it was in January 30th. And I remember after about 1 week, we got a patient from Wuhan in China, and in Alapura Medical College, we have the privilege to treat him. And about 3 weeks, he was in the hospital. and it was the second case in India, and it was the first case. It was discharged from in a hospital. It was the second case and first case to be discharged. And still he is in close contact with me, and he is a bright student. He is a medical student from Wuhan. He is doing very well, and we have interactions in between also. I think I will discuss in my this topic in 3 sections. First of all, I would briefly discuss what are the achievements the government of Kerala or the people in Kerala or the health workers in Kerala have achieved regarding this COVID. That point I will discuss initially. And the second point, definitely we have a lot of challenges in front of us. That the 5 points, 5 achievements, then 5 challenges in front of us, and also 5 things to be done in future also. I think I will divide this my presentation into these 3 sections and 5 points under each section. First of all, coming to the achievement, of course, it is the vaccine itself, and Dr. Amar Kettle has beautifully narrated this story also. And as he mentioned, I also had my privilege to take the vaccine last week, and for me also it was a very pleasant experience. There was no much complications or even mild fever. I haven't developed any fever at all. I was able to work in the next day itself, and with more confidence. Now I am working in tomorrow is my OPD in Ahalia Medical College. I think I am half protected. By taking one vaccine, it is the authorities say that we are 50% protected. So I will be more confident in managing the patient. So the first achievement from our side, it is not only from our side, it is a universal phenomenon. But the government of Kerala also has taken initiative to make it available to all health workers without any lacunae. And every day, as Amar mentioned, 100 doctors or health workers or ASHA workers or nursing staff, they are getting the vaccine. And so availability of the vaccine was the first achievement in against this corona as a most important point we had to discuss. And number 2 is very, very important. That is the case fatality rate in Kerala is the least in India. So the students especially should know what is this case fatality rate. If you are taking 100 cases of COVID, how many patients have died? The number of deaths per 100 COVID patients, that is the case fatality rate. And it is, you remember, you should know, it is only 0.36 in Kerala as per the latest statistics. Only 0.36, whereas the national average is about 1.54. Why we got such a rare achievement? It is because of the primary and secondary and tertiary care that we are giving to such excellent care that we are giving to these patients. In the primary care, we are properly identifying these patients, properly referring, or they are treating the patients in this the first line treatment center or the COVID second line treatment center, whatever it may be, depending upon the severity of the patient, they will manage them in the first line or second line treatment. And if they are not controlled in that level, they will refer the patient to secondary level, and even they are not controlled in that level also, with complications or with the comorbidities, as Gopal sir has mentioned. Such patients will be referred to tertiary center, medical college hospital, where they will give a excellent tertiary care. We haven't in Ahalia Medical College, we have 60-bedded ICU, and 24-hour these doctors are there, nursing staff are there, PG students are there. They are giving all utmost care to these such patients. As you know, even though the COVID is a mild illness in 80% of the cases, in 20% of the cases, it can develop complications. It can develop COVID pneumonia, or it can develop multi-system involvement or kidney failure, cardiac involvement. As Gopal sir has mentioned, especially in patients with comorbidities, it can produce a lot of complications. So, in spite of this severity of the disease, or in spite of the spread of the disease, we are able to keep the mortality rate at a very low level in India. That is 0.36%. That is, I think, the second achievement as far as Kerala is concerned. And third, what is the third achievement? So that is a very important thing, and it gives a little happiness to us, because in spite of this such a increase in the number of cases in Kerala, about 49% of the ICU beds are still available for coming patients. Only 51% is occupied, or 49% of the ICU beds are still available for the patients who need an emergency care. and about 15% of the ventilators only are used. So 85% of the ventilators are still available for deserving patients or who are in need of a respiratory failure or respiratory distress. So that is a very important fact that we gives happiness or gives us a calmness to us, because in spite of the increase in the number of cases recently, we have enough ICU facilities in our hospital, especially in the tertiary care hospital. That is also another important point of achievement or happiness to us. That is number 3. And number 4, even though there are reports of genetic variation, especially in the UK, UAE, and South Africa, so far, luckily, even though there is an international travels are there, the reports of patients with genetic variation is not much high, as Amar may be knowing it. It's not much high in Kerala, because this genetic variant coronavirus has got a 70% increase in the infectivity. It is more able to spread than the traditional coronavirus. But luckily, the entry of this virus is also not so fast in our state. That is also another important achievement. And the final and the last, but is not the least, it is our the strong primary care, because we have very good primary health centers. We have strong this COVID first line treatment center, second line treatment center. All these centers are equipped with our doctors, as well as the nursing staff, as well as the paramedical workers, ASHA workers. They are working since the last 1 year, 24/7, and they are able to keep the morbidity as well as the mortality at a lower level. So these are the 5 points which we can consider as an achievement. That is the vaccine, the low case fatality rate, the availability of the ICUs, etc., the less number of genetic variation, and finally the strong primary care facility. So the second point is a little thing to be afraid of, or frightening points are I have to discuss. There are 5 points to be discussed as challenges. During the last 2 weeks, there is an alarming increase in the number of patients in COVID, especially in the last 2 weeks in India, and also in Kerala also. And when considering the test positivity rate, the number of positive cases in Kerala is about 9.5% as per the last 2 weeks statistics. Just behind that is the Maharashtra, where the test positivity rate is 5%, and then it is the Nagaland, that is 4.7%. So why it is increasing in the last 2 weeks, or recently, what is the reason for the increase in the number of cases in Kerala? This apprehension was shared by the director Ahalia Group of Institutions and also by the Gopal sir, and I think Amar also will discuss it in detail. I think the last this local body elections and also the reversal of this lockdown, we have giving more and more social life to these people of Kerala, because it is a necessity also. This the +2 as well as the +1 schools, higher secondary schools are open, so there is a more chance for mingling of these patients, and that may be the reason for the recent increase in the number of cases or positivity, which we have to consider as a very important challenge for us. That is number 1. And number 2, the care of the old age persons in Kerala, because we have about 40 lakhs senior citizens in Kerala. Since the last 1 year, they are in reverse quarantine. It is a very unfortunate situation, because the social life is the most important aspect of a person, to mingle with person. As the social health is also very important thing, but they are not allowed to do that because of the COVID fear, reverse quarantine, and this lockdown. This old age people are suffering a lot, especially in Kerala, where the number of old age people or senior citizens who are more than 60 is about 40 lakhs. So this point we had to take it as a challenge. And another one is the presence of comorbidities. As per the latest statistics, 3% in 1 in 3 have hypertension in Kerala, and 1 in 5 has diabetes in Kerala. That is why Kerala is known as the diabetes capital of India, or hypertension capital of India. So as Gopal sir has rightly pointed out, patients with comorbidities have got a very high chance of developing complications like COVID pneumonia. Daily we are witnessing it in our ICU as well as in the wards. When a 30-year-old man with healthy man without any complications or without any comorbidities coming to the hospital, within 7 days he will be relieved of his symptoms. Whereas a person who is 60 or 70 with uncontrolled diabetes or hypertension or heart disease. If he is unfortunately got COVID, he will have some complications. He may develop COVID pneumonia, or he may develop renal failure, or he may develop some cardiac issues, etc. So presence of these comorbidities as well as the issue of the old age is the second challenge we have to consider. Number three, definitely genetic variation also, because Kerala is a hub for international travel. A lot of people are coming from UAE, UK, etc. So that challenge also we have to consider. And fourth point is the one of the most important point, that is one of the long COVID. After getting COVID, after about 4 weeks, if the patient is developing some symptoms, it is known as the long COVID. It is another unfortunate factor with the COVID. In 2007, Dr. Amarfetil may be remembering, we have an epidemic of chikungunya in Kerala. After this chikungunya, still there are patients with disabling arthritis. They are coming to us in Alleppey also. There are a lot of patients coming to us with joint pain, arthritis, arthralgia. They have a lot of morbidity. Similarly, some viral infections can produce morbidity and long-term sequelae. Unfortunately, COVID is one infection which can produce a lot of sequences, long-term sequences. Most important is pulmonary complications. Patient can develop lung fibrosis, patient can develop breathlessness, or patient can develop some psychological issues also. He may go into a mental depression, anxiety, phobia, etc. So this long COVID is another important aspect which we have to tackle. Now we are tackling it, and we have enough number of post-COVID clinics in various hospitals. Even in primary health center, Government of Kerala is conducting this post-COVID clinics also. So that is another important challenge that we have to face. And fifth one, we are coming back to our social life. The schools are opened, and the cinema theaters, then film shooting has opened, and this assembly election is coming in the near future. So these are all challenges, because these are places where people can again come together and they can mingle, and so the social distancing will be an issue. So we are again we are afraid of a second wave, or we can say, or third wave of this COVID in the coming future also. So these are the 5 challenges which we had to consider. One is the recent increase in the test positivity, then issue of old age persons as well as comorbidity in Kerala, then genetic variation, then of course the long COVID issues we had to consider, and finally the reopening of the schools and other starting the social life. These are the challenges, 5 challenges which we had to face in the recent future, I think, and what we had to do in the coming future. 5 points only. I will mention the 5 points. These are again the same thing. One is wearing the mask, because by vaccine alone we are not getting any sanitary immunity. It is one of the sanitary immunity, because still, even though Amar as well as I have taken the vaccine, still we can get an infection and we can spread the infection to others. It is not the absence of any sanitary immunity, because still we can have our this virus in our throat, our nose, and even though we are not developing an infection, we can spread the infection to others. That is why even after vaccination we have to continue using this mask. That is one thing. And number 2, the social distance as well as hand washing, etc. That also we have to continue till there is a decrease in the Kerala people develop herd immunity, or there is a significant reduction in the number of patients. We have to continue these measures. And number 3, vaccine has to be taken by every person when it is available to them, because there is, unfortunately, I don't know what is the status in Trivandrum. Amar will highlight that point. In Alleppey, what we can see is, even though 100% are allowed to take vaccine, only 70 or 75% are coming for this procedure. They have some excuses. I had fever, or I am taking some medicines for that, or I am taking this clopilate or aspirin for blood clot, the prevention of blood clotting. So some silly excuses. I don't know why it is happening. So that we have to overcome. Everybody should take vaccine as a Murda Sanjeevani, because it is a very important, because we have no antiviral drugs so far. Long COVID is a very important issue. So such things we have to consider. So only Murda Sanjeevani is a vaccine. So everybody, if they got a chance, definitely should take the vaccine. That is the third thing. And fourth thing, we have to control ourselves to reduce the social gatherings, because I am very much afraid regarding the forthcoming this assembly elections also, because we have seen rapid surge in the COVID cases during the local body election also. So we have to control ourselves till we develop a adequate herd immunity, till the number of cases are very much controlled. Otherwise, now you can see what is the situation in UK. They have again started lockdown, and they have curtailed all social gatherings, and everything was curtailed in UK. So they have declared a lockdown in UK. So that is the situation in UK. So we have to be very much careful regarding this gatherings, etc. That is another important thing. And finally, care of old persons, elderly, is the responsibility of all family members, I think, because now I can see a lot of persons, 90-year-old, 100-year-old, 80-year-old persons are coming to our hospital with COVID. Why they are infected? How they are infected? Because before this opening of this the schools and everywhere, the lockdown was a little effective, and people were not going outside. Now we can see the family members, all young family members are going outside. They are traveling in buses, or they are traveling, they are going to malls or schools. Then they are coming back to the home. They are coming back to the house. Now they are mingling with the elderly, and thus they are infected. I have seen a lot of patients who are bedridden with hemiplegia or quadriplegia, or patients with cancer who are bedridden in the house. How they are infected? Because the reverse quarantine is not at all effective now. Suppose the people are going out, younger person, the son or daughter is going out, she is going for work or he is going for work, the grandchildren are going to the school, they are coming back, and again they are mingling with the senior members of the old age elderly persons, and they are infected. A lot of patients are coming to, elderly patients are coming to the hospital with COVID pneumonia, and many of them are succumbed to death also. So that point we had to consider in the coming future. We have to give extreme care and protection to our elderly people in our house as well as in our community. So these are the 5 points which I am mentioning as things to do. We have to keep the mask and the social distance. Okay, the vaccination is a must, and everybody should take that privilege if there is a chance for a vaccine, which will be available to everybody, we hope. And this we have to reduce the gatherings. That is the fourth point. And finally, we have to protect our elderly. So these are the things which we have to consider in COVID in the future. We have got enough achievements, but there are a lot of challenges, and there are things to do in the future also. With this comments, I am concluding my short presentation. I think we'll have more and more discussions, because this director sir himself has raised a question. His son has got a second infection. That is also a very questionable thing, because to say that it is a second infection, we have to identify the genetic strain of the second virus. Then only we can say it is a second infection. Otherwise, the test positivity may be wrongly interpreted. That points we will discuss later. But second infection is a very, very, very rare thing. Only about 9 or 10 cases are reported all over the world regarding the second infection. So such points we had to discuss. I think Dr. Amal and as well as Dr. This Prem Narayan, he's an endocrinologist, and Professor Roshan also will discuss a lot of points. With this, I am again thankful to the organizers for this opportunity. Thank you. Thank you very much.
Thank you, sir. Thank you very much for this insightful session. You have clearly shown us what to do exactly on points. So, and see, people going out, we're all people going out, we're all bringing back infection. So I think all of us should keep these things in mind. Sometimes it just misses off. We have got the freedom to go out, and we're enjoying that freedom. Down the line, we are forgetting to be responsible. I hope all the participants will keep this in mind when they are going out next time. Now I invite Dr. Prem Narayan, who is a consultant endocrinologist and diabetologist of Ahalia Diabetes Hospital, to share his insights with us. Prem sir, are you here? Yes.
Yeah, just a minute.
Yeah.
Just a minute. Yeah, I'm right now in the OPD. Just a minute, I'll join now. Just in a 1 minute.
Actually, today being a holiday, he has a lot of patients in the hospital. So he had called me earlier.
Yeah, exactly.
Just give him 1 minute time so that he can set up his premises. He's in the OPD now. That's why.
Yeah. Sorry, sir. Am I audible?
You're very much audible, sir. Now we just want to see you.
Right. Just a minute. I have switched on the camera.
No, you're not visible yet.
I mean, camera is working?
No, you're not visible, sir.
Let me check. Yeah, just a minute. Hold on, please. Here the camera is on actually.
Maybe what we can do is you can just log off and log in again. So meantime, we will go ahead with Professor Roshan Sanu. So once you're set, we can come back to you. Yeah, it's fine, perfect.
No, 5 minutes.
Everything is perfect.
Thank you.
I think till Prem Narayan sir comes back, we will move on with Professor Roshan Sanu. Roshan sir, are you here? Okay, Roshan sir, as you know that you are a COVID-19 survivor, and along with you, your parents also had fallen sick. So could you please share your experience with us, and then what were the difficulties that you faced, and how was it difficult for you to know? How difficult was it for you when all your family got infected together, and how did you pull yourself up? So please share your experience, and then after listening to Roshan sir, we will go back to Prem Narayan sir.
Am I audible, ma'am?
Yes, you're audible, sir. You can be a little more louder because you're a little feeble now.
Okay.
Yeah,
now
perfect.
it is,
Yes,
okay.
perfect.
First of all, good evening, and respected dignitaries, respected chairman, sir, respected director, and a very respected doctors, and my dear colleagues, and all the respected listeners. First of all, I am telling that this may be out of the anticipation of the listeners, because I am going to share my exclusive experience. I don't know whether the other COVID patients are feeling like the same experience or not. Somehow, first of all, at first I was having a feeling of a fever that is not like body temperature, but mostly I am feeling tired. That is while getting out of bed, while getting up in the morning, I am feeling very much tired. Instead of getting up fresh in the morning, I was feeling like I was getting out of a vehicle after a long run, because my body was in a lot of pain. So I don't know. I heard that the symptoms of COVID is like that: body pain, then fever, but I was not having fever. Body temperature was normal. But what happened was, when I moved on to the second day, and when I was having breakfast, I came to know that I have lost the sense of taste. So while taking my breakfast, it was feeling that there is no sense of taste at all. So I was in kind of a perplexed situation. What should I do? So I discussed the experience with my mother, and she said she have the same experience. So we both went to a private hospital for taking the COVID test, because I have heard from the news and our social media and some other COVID patients that the main symptom of COVID is the loss of taste and smell. So me and my mother went to one private hospital in Palakkad district and took the COVID test, and the result came out as positive. So uh, after that, while returning, I have called my health inspector. That is, I am residing at Puduperiyaram in Palakkad district. So I have contacted my health inspector and informed that we have diagnosed COVID positive, and we returned home. Then after some time, one ASHA worker came to visit us, and she said that we have to remain in home quarantine. Because my mom is also under the age of 60, and I am also in the early 30s. So they didn't feel like moving us to hospital, so they asked us to remain in home quarantine. And after some time, she consulted with the doctor working in our PHC, and she brought us some medicine also. It included paracetamol and other vitamin tablets. So at that time, my father was also with us, but as we have tested positive, the worker instructed us to take COVID test for my father also. So the next day, he also went to take the post COVID test from the PHC, and he also diagnosed as COVID positive. So three of us were having COVID positive, so we were remaining in the home quarantine. The major difficulty was we were not able to go out for purchasing anything for household items or for preparing food or something. We were not able to go out. So, but the thing is, um our relatives are residing nearby itself, so they brought materials to make food like rice, sugar, tea powder, etc. Everything they brought us. And my brother-in-law also brought a lot of things, that is fruit, including fruits and like that. So the major thing is uh, during COVID, or while experiencing COVID, a lot of we are feeling a lot of tired. So the doctor also advised us to take some healthy food, including a lot of vegetables and fruits, and like fruits including vitamin C. So mainly oranges and gooseberries. So we brought a hell lot of them uh, for having. Then another thing is, I also my HOD, that is our computer science department HOD, also called me, and Dr. Gunashekaran sir. So he advised me to uh, inhale steam inhalation, because somehow he came to know that uh, the COVID virus should not enter the lungs. So the steam inhalation prevents these COVID viruses from entering lungs. That is what he advised. And I followed steam inhalation 3 times a day. Me and my parents also. So it was, I felt a lot better. Then beyond these symptoms, I also had throat pain. So I informed my doctor that I have throat pain also. And my doctor instructed to take antibiotic named azithromycin for 3 days. So after 3 days of medication, then we were somewhat okay. Then there is no symptom of fever or nothing like that. My body was also recovering. Then the feeling of tiredness is also wearing off lightly. But the thing is, the sense of taste and smell was not back. So these two senses were not working perfectly, even after a week or so. Then I have tested COVID positive for the first time in November 16th. So the ASHA worker instructed to take the next test after 10 days, that is for November 26th. And that day, we came out of quarantine. We again went to the nearest PHC, that is Pudupiriyaram, to take COVID test conducted by the government. So at that time, after 2 days, the result came and we were diagnosed negative. But even after the result turned out negative, I was not having the sense of taste or smell. And the doctor instructed us to remain in quarantine for 1 week more. That is, I can go out of the home after 1 week only. So after 1 week and again remaining in home for 4 or 5 days, then only I went back to work, because I don't want to put my colleagues in risk also. So by December 5th or so, December 6th, I went back to normal life, and my parents also were having a good recovery. So after that, up to this point, we were not having any problem related to COVID or so. So these are my experience as a COVID patient. So as I have told earlier, this is my exclusive experience. I don't know whether all the other COVID patients are feeling same thing. Thank you, ma'am.
Thank you, Roshan sir, and thank God that you are hale and hearty now, and you are back among us. So, and now we would like to hear from Dr. Prem Narayan. What are the endocrinology implications this COVID-19 has? We listened to Dr. Amar Fettil and Dr. Prem Padma Kumar sir, and what are the symptoms that Professor Roshan Sanu faced. Now, this has a lot of implications on how the body reacts. Maybe the long COVID also could be. If you could explain what are the endocrinology implications, it would be really great, sir.
Right. So first of all, good evening and apologies to all of you. I was having a little bit busy OPD today and had some technical snag also. And apologies, Amar sir and Padma Kumar sir, one of my teachers, even a teacher for my sister also in Alleppey Medical College, she was studied. Thanks to Bindu madam and Ahalia team for inviting me and giving me this opportunity to interact with August or audience. And so the endocrinology aspect. So actually, we all know that all of our life has changed from the last March, isn't it? So it has changed drastically, and it has even changed the clinical practice also. Because from the endocrinology point of view, because when you know endocrinology, when you hear about it, is basically all about the hormonal disorders that we deal with. So the commonest hormonal disorder or the problem that we encounter in the daily life or the daily clinical practice is a diabetes mellitus. Yes, diabetes mellitus is one of the commonest endocrine disorder that we see, and it has a great implications in the COVID-19 setting also, because initially And when you can see, when last March and all, when the lockdown and all these COVID-19 flare-up was coming up, and the people were all into the shell, and everyone was worried about the diabetes aspect, because the initial studies and reports that were coming up was like those who are having diabetes will have a very great risk or higher risk of contracting COVID-19 infection, and even the mortality aspects. And also, I still remember the patients who used to call, because it all became from clinical practice to teleconsultations, because it was, we were not at all known to about this teleconsultation, and it was never done at all, teleconsultations. But then the clinical practice changed from the OPD practice to the teleconsultations. A lot of people started calling up. They were worried. The diabetic patients were worried, and they were calling up, sir, what should we do? And so that initial teleconsultation management was also difficult, because it was all new to us also. And apart from that, the initially when you see when this news was there, and all patients were worried, and those who were not taking medications properly, they were taking the medications properly. And those who were not, those who were having high A1C, when they were advised to take insulin, they had no problem. They were ready to take it straight away, because all the fear and worry factor was there, that the diabetes could be a detrimental factor if they contract the COVID-19 infection. But over the time, over the past few months, that fear factor has again gone, I would think, because right now, today, if you see, out of the patients that I've seen, most patients, or 50% of patients, are having very high A1Cs. So that fear factor of COVID-19 and even diabetes getting away from the public aspect. But clinically, yes, many of the published studies have shown that it is difficult to put if there is an increased risk for contracting COVID-19 because of diabetes, because we have seen a lot of diabetics now coming after the COVID-19 unscathed, those who are having only asymptomatic or mildly symptomatic COVID-19 and all. But those definitely Padma sir will be able to throw more light, because those who are developing severe pneumonia or going into ventilators, if they are having a diabetes mellitus and other comorbid illnesses like hypertension or even obesity or even cardiovascular risk factors, these people are very much an increased risk of higher mortality rate. So that we are definitely seeing. But yes, again, the fear factor has come down. People are again coming, not much caring about the diabetes part. But yes, definitely it is required, because it can lead to severe infections or even mortalities in those who are having a severe COVID-19 infection. Then the other endocrine disorder, yes, the commonest, obesity. Obesity, I've seen a lot of papers have come up from even from the Western side and all, that the obesity is one of the major risk factor for severe pneumonias and even mortality, because we all know that obesity, diabetes, these are all basically pro-inflammatory conditions. So already pro-inflammatory conditions, and when you are getting a COVID-19, this is again adding fire to the fuel, because again a lot of mediators and cytokines are getting released into the circulation, resulting in a cytokine storm-like situation, and that can be like a fire to the fuel, with the diabetes and obesity being already a setting for the inflammatory stage is already there, and the cytokines are again adding up. That can result in all the prothrombotic conditions. Hence, that's why many of the time this heparin and or anticoagulants are being added to the treatment regimen, and so that the pulmonary emboli and all sort of complications can be prevented in that sort of aspect. And again, another important disorder is a thyroid, because you know that hypothyroidism is very common in our across the country, and not only hypothyroidism and also the hyperthyroidism. All these thyroid disorders are very common, and right now what we see is that there is a huge number of increase in the subacute thyroiditis, because it usually happens following some viral infections. What happens is that already stored hormones are being released into the circulation due to the inflammation and the that happens to the thyroid. It's a thyroiditis. Itis means always inflammation. So thyroid gland is inflamed because of the various proposed mechanisms of molecular mimicry and all with the viral infection. So subacute thyroiditis is very common these days, and we see a lot of patients coming with a neck pain, and when you, not very much any, a proper history, you will not be able to elicit a COVID-19 or even viral infection. But some people will be complaining of very mild symptoms like an earache or even a mild upper respiratory, but the COVID would not have been tested. And following which, they after 3 to 4 weeks, they might be coming with a tender thyroid gland or even a mild thyrotoxicosis with mild tremors, weight loss, palpitations, etc. So subacute thyroiditis is also very common these days, especially with the viral COVID pandemic. And another important aspect is also that when you come back to the diabetes part, is that there is a huge number in the increase in the number of young diabetes cases, especially type 1 diabetes. We are seeing a lot of type 1 diabetes, not only from my side, and inquired with a fellow endocrinologist across the country. They're all suggesting like they were seeing a rise in the number of the type 1 diabetes also. So there is definitely some relation with the COVID-19, because there are proposed mechanisms that the COVID-19 can attack the pancreatic beta cells, and hence insulin deficiencies can happen, and autoimmunity can trigger off, resulting in type 1 diabetes, and even stress hyperglycemia, because many of the time the COVID-19 patients, even severe infections, are all treated with the steroids, because we know that there are studies that came up with, like the dexamethasone can have a good outcome in those with severe infections. And so steroids can add again fuel, and again adding up to the uncontrolled glycemia part and all. So this can also add to the fuel, and even may increase the risk of the mortality rates. So these are some of the endocrine aspects, basically the diabetes and thyroid. Other hormonal disorders, I don't really seem that there is an increase in the incidence or of the other hormonal disorders that we see. But yes, diabetes is one of the most commonest, and even thyroid, I would put it like these are the two most common endocrine problems that we deal with in the daily clinical practice. So thank you. That's a small briefing up from my side, and any questions or queries or comments, all are welcome.
Thank you very much, Dr. Prem Narayanan. Thank you. And the last week, I had taken one of my relatives to him, because she had a small earache, and then she had some throat discomfort. And then ultimately, it was like, her thyroid gland was infected due to some viral infection. So, and we need doctors like you to rightly diagnose it, so that we are all in a perennial scare. Now, when all these doctors are talking, you can see that I am totally perplexed, because what will happen to me when it comes, or what will happen to my family when we get infected. So I know that getting the jab is the only way out. Now I request the participants to put your questions down on the chat box so that I can read it out to them, and our panelists can answer your questions. Now you can type down your questions here. I see some comments on the chat box that they are all mostly information sharing kind of posts. And I see that our chairman has mentioned that UAE may go into another lockdown. Do you see Kerala going on to another lockdown, Aman sir?
Lockdown was a time when as pointed out by Dr. Padma, self-discipline is what's the key. It is the most basic thing only that we have to do to keep COVID in check. But given human nature, we are only frightened of a stick. So someone to beat us up, then we are ready to comply. That is human nature. And so restrictions on freedom are looked upon with disdain and anger, and say that we will do what we like. But the germs are so indifferent, and they don't have any partiality, they don't have any doubt to us, they don't have any irritation or any grievance to us. So they attack everybody in the line, just like standing in front of a running train. If you are in the way, you will get it. So keeping that in mind, we have to what we call observe the basic 3 things to avoid transmission of infection from one person to another. So sometimes, in fact, some of our district officials have been saying that maybe our discipline is falling so badly, we might have to go in for such things. But the distress element is so much. People who earn their lives with daily work and all that, for them, lockdown is a horror. So keeping both in check, that's why the government has done did away with the lockdown after a certain period and started to let people back to normal lives. But then I think everyone collectively has to maintain discipline for the sake of each one of us and for the sake of our public society.
The lockdown is not is just a matter of policy. When you know some certain countries gone for lockdown when there were very small, I mean, few number of cases in the last year. But certain countries, as you know, even the most developed countries, they didn't bother about lockdown when they were really suffering from that, like UK and US. UK later understood the seriousness, but US they turned a negative attitude for the lockdown.
Yeah.
But certain countries like Korea, South Korea, and New Zealand, they're gone for lockdown even when they had only a few number of cases. Even India also followed the same thing. So that's why now we have got the result also. We have almost contained the disease. And UK is in the second lockdown now, till February middle. So lockdown is a matter of policy. The government can take a decision, they may not take a decision. It depends on your attitude, your policy.
Thank you, sir, for sharing your views on that. There is a question from Setunath Vishwanathan. Any specific precautions needed to be taken, those who have thyroid and diabetes? I mean, apart from the normal precautions, do they have to take anything extra? Like any extra measures have to be taken so that they don't get infected, or if they get infected, they don't get into trouble?
That is for Padmavar or for Dr.
Yeah, definitely, I can take it up. And so, rather than extra precautions, taking care of if you are already diagnosed with diabetes or even any thyroid disorders, taking your medications properly and making sure that your diabetes aspect is under control. That is the best part. And also the dietary aspects. We know that usually even the youngsters are all after these sugary drinks, colas, and a lot of things like that. And even the junk foods, or to put it up, the bakery products and all. So taking the sugar levels down. So the consumption of all these junk foods or even all these sugary drinks are all definitely that should come down. And the more you will have to look into the physical fitness aspect also. And so maintaining the COVID protocols, you can definitely do your physical activities and fitness activities to keep yourself in a fit level and with the good controlled glycemic levels. So that will be the best way that you can take it up. And maintaining the COVID protocol so that you do not contract the infection. So that would be the perfect way to go about it.
Thank you, Doctor.
Can I share one more question to you?
Hello.
We
Yes,
all
sir.
know that the
Hello.
mortality and morbidity in COVID-19 is more in diabetic patients. But what is your opinion about the affinity of diabetic patients to contract the disease? Once they contract the disease, definitely there is a higher element of risk in diabetic patients. And what is your personal experience in this thing? I mean,
Yes,
the
sir.
affinity of diabetic patients to contract the disease, not the morbidity after contracting the disease.
Got it, sir. So actually, we do not have any. I mean, initially, as I said, during when the initial part, like the last March, April, or even May, that time, we were all feared about from the Italian and Spanish data that there is an increased risk that diabetics will contract the infection. But over the period of time, the data has evolved so much that there are not much studies that has directly proven or even stating that there is increased risk of contracting the infection. It is like once the infection is contracted, even that time also, if the severity due to the other comorbidities, the patient land up into severe pneumonia, then if the patient is having a diabetes also, in that case, the mortality rate is high. Rather than the contracting the infection, that we do not have much good data. I mean, we have data, but data stating that there is increased risk that diabetes will get the infection. I think Padmakumar sir, if you can.
Prem, very happy to meet you in this.
Thank you, sir.
Yeah. Okay. You well explained all the endocrinological aspects, and in daily practice in our ICU, we find it very difficult to control the diabetic status or glycemic status in patients who already have diabetes. As Gopal sir has rightly mentioned, these diabetic patients, even though as Prem mentioned, there is not much studies or data regarding the chance of developing an infection, But once they got this COVID, they are definitely have a high chance of mortality when compared to other patients. Gopal sir. Means they are more prone to develop various complications of diabetes itself, maybe diabetic ketoacidosis or severe infections, pneumonia, etc., bacterial infection. And also the COVID-related problems are also high when a diabetic patient is acquiring an infection. That is our one of our observation. And back to Prem, I think this many factors are causing this hyperglycemia or worsening of the diabetic status in patients with the diabetes. One, as you mentioned, the use of steroids, number one. And number two, the stress hyperglycemia is a very important aspect, isn't it? The COVID is a stress-producing condition. Everybody is having a very great phobia regarding this COVID. That is a real fact. So that is another thing. And the virus itself has got some action on the pancreas, which produces an insulinopenia. So these are multifactorial. So anyway, a diabetic patient is at a high chance of developing complications as well as mortality when compared to a euglycemic, a normal person. That is my observation. I think Prem also agrees.
Yes, sir, definitely.
Yeah, thank you. Thank you.
Good evening, doctor. Good evening, doctor. Doctor,
Yes, good evening.
I have one doubt, doctor. I have taken my vaccine on last week, and the next vaccine is on February 10th. For type 2 diabetic patient, what are the precautions we have to take, doctor?
Prem, yeah.
I have taken one vaccine on last week, first vaccine, COVID vaccine, and second dose is on February 10th.
Yeah.
And as a type 2 diabetic patient, what are the precautions we have taken after the first vaccine and the second vaccine?
So for a diabetic patient, there is no need of any special precautions, sir, because it is like any other diabetic patient. You have to control your blood sugar as much as possible. Try to keep the blood sugar at a normal level, and it is not connected to vaccine at any way. That is, to my knowledge, it is not connected to the vaccination. After taking the first dose, we will get about 50% of immunity. That is what the data says. And only after taking the second dose and after 2 weeks, we will get about 70 to 90% of protection. So till that time, you have to take all the other precautions. And most important is the diabetic status have to be controlled well. If you are
after the second dose, any precautions we have to take, doctor?
Yeah, definitely. Everybody has to continue their precautions. As we mentioned, even after taking the second dose, even after 2 weeks, we will still can spread the infection to others, because the sterilizing immunity is not acquired by this second dose also. The Summer will explain it, I think, again, because after taking the vaccine also, the second dose also, we had to continue all the other protective measures, precautionary measures like mask wearing and social distancing as well as hand washing. Everything we had to continue, because still we can spread the disease to others, because we can harbor the organism in our throat as well as in the nose, so that we can spread the infection to others. So we have to continue wearing all the precautionary measures. I think yeah.
So can I ask one question?
And we have to
Hello.
with all the people. And not only that, there are two important questions most of people are waiting to ask. One is whether we got to do vaccine, to be or not to be, one thing. Secondly, if we go for a jab, which one? What is our option? This vaccine or the other vaccine? I would like any of the experienced doctors, Dr. Patmkumar or Dr. Sorry, their opinion.
I think Dr. Amar will answer it first, and after that I will supplement.
This is one question which everybody wants to ask, and people are eager to hear.
Yes, sir, definitely.
The two questions I think were, one is whether to vaccinate or not. That is the first one. Is that right? That was the first question. And the second one, which vaccine? Yeah. So the answer here is that when your turn for priority comes, you have two choices. One is to wait and not get vaccinated and maybe take a chance with getting a COVID infection. Once you get a COVID infection, you do not know what kind of dose you are getting, what kind of virulence, and what condition your body is in at that time. So then you are taking a chance with the infection. And if factors are adverse at that time, it can become a very, very bad experience for anybody. On the other hand, when you take the vaccination, You might have a small fever, some body ache, something might happen, little things like that is a no, because the vaccine has come out after, just not after development, it has come after a clinical trial and all that. So this clinical trial means the safety has been established in a recommended large number of segment of population or volunteers. So you will have a mild illness, your body gets the immunity, and then you have a much less chance of getting it from society. Basic carefulness, as Padmagama said, you have to maintain, but your chance of not getting the infection are much higher. So it's just like on a rainy day. Suppose June 6th, your college is reopening, it's a rainy day. And suppose when you set out of home, somebody asks you, you want an umbrella or not? So it's not raining at the moment, but it's always a wise thing to carry an umbrella during the rainy season if you don't want to get stuck somewhere. And even if you carry an umbrella, your toes might get wet, your slippers might get wet, your bag might get wet, but you won't as a whole get wet. So that is the principle of vaccination. You will remain safe without any other problems. And what vaccine, second part, it's a matter of choice. Right now we have the two vaccines coming in. Both vaccines, the first one has completed all the trials, and the second one is actually this administration is part of the, that is what is being said. But as the days go on and the situation is being monitored very tightly, we can say with more and more confidence as each day goes by. Right now, Covaxin is being given in large segments of the population of the first tier of health workers also. So it's an evolving situation. So we will be able to say in a few days or weeks that the experience is being reviewed on a daily basis. So then we can say with a reasonable amount of confidence that we both are okay. And that's what we hope for.
Thank you, sir. And with an example, you have explained the whole thing with a good example. Thank you very much for that. Chairman, sir.
I've got a question.
Yeah, I've got a question. Doctors here. Have you had your jab? Doctor.
You're asking me? Yeah. In fact,
have you had your jab?
Yeah, I had my vaccination first dose. That was the 21st of this month. My dad and went to the neighboring site. It's all fixed previously. So when they got the vaccination, some little local pain has been there for the last 3 days after that. That's all. On day 1 and day 2, I felt slightly tired. It was just like a feeling of, is a fever going to come tomorrow? But I never had a fever. I kept paracetamol ready. I did not have to take it. And I was going for my usual daily work also. I was involved in my daily work also. Did not have to take a day off or a day leave.
Any seminar, by the end of any seminar, you need some take-home message. So I'll give you something this day. I had my vaccination last month. So we here in Kerala or in India, you have the option of 2 vaccines. So you have the luxury of 2. So people are deliberating among themselves which vaccine to go for. Here we don't have the option. What we have available in Abu Dhabi, UAE is Sinopharm. And we had, my family members, they had, my colleagues, doctors, they have, and it is something like a compulsory. I mean, they don't say compulsory, but if you don't vaccinate, you forfeit a lot of facilities as a social being here. You will not be permitted to go there. You will not be permitted to enter a hall. You will not be permitted to travel. So indirectly, it is mandatory to go for a Sinopharm vaccine here. And Sinopharm is the only one available, even though there are other 2. The only available in the vaccine for the mass vaccination is only Sinopharm. And the only person who has vaccination is Dr. Mupan. You are the chairman of Aster Medical. He is my friend, and we were together in Calicut Medical College. So he had it. And next week, I also had. We never had any problem. Along with me, we had almost 100 people, other doctors, paramedic staff of the hospital. We never had a single ailment after vaccination. We are perfectly okay. So what I want to say is that our people in India or Kerala, you should ask for Covaxin, not to Covishield. Because Covaxin is a similar vaccine to Sinopharm, which has got lesser side effects, or even the side effects are 0.002%. If that percentage of side effects, even any vaccination can have. Even water injection can have. So when it comes to a vaccination, people are talking about the negative side. Any medicine can have. Even paracetamol can have a side effect. So comparing to all these side effects, the Sinopharm effects was very meager. I mean, It is totally negligible. So my take-home message for the participants is to go for Covaxin, not Covishield, because Covaxin is a time-tested technology. This is a inactivated vaccine which we have been using for the other vaccinations in the past. The other one is a new technology. So Covaxin is similar to Sinopharm. I think you can correct me if I am wrong. The technology of Sinopharm is similar to Covaxin, and which is more. It is said to have less side effects. And you see the number of population who have been vaccinated. In UAE itself, 2.5 million people have been vaccinated in the last 1 month time. And so forget about the other nation countries, including China and the countries to where China supplied the vaccine. The reports of side effects is very negligible. So, and the funniest thing is that the vaccinations we had in the last 1 month, Mr. Deepak Verma also is also in Abu Dhabi. He also had this vaccination, the guy who was talking about the diabetes too. So we are still in the third phase of trial. The Sinopharm here is in the third phase of trial. But we cannot ask whether we are on trial basis or not. In India, because we have a lot of freedom, we are arguing to the authorities whether you have done the third stage and where is the literature, where is the lab reports, where is the other approvals, all these things. Here we don't have the freedom to ask such questions, and we are vaccinated, and we simply go and get it done. But thanks God, we don't have any problem at all. So in India, people should go for the easiest available vaccine rather than deliberating on highly hypothetical things. That is one thing. Secondly, even if you are, the other message what I would like to give is that even if you are vaccinated, don't feel a false sense of security. You can still be a carrier. So because you remember, if you have small children or elderly people in the home, they are not vaccinated. Even though you are vaccinated, it does mean that only you are protected. You can still carry the infection in your nose, mouth, your body, your dress, everything. So once you go out and come back, you can contract the disease to your children, your other family members. So don't feel any high sense of security after vaccination. It only assures that you are vaccinated and you are secure. But it doesn't mean that you cannot carry it. You can still be a carrier and contract the disease to others. So still, even after vaccination, follow mask, social distance, and hand wash, and other precautions. So that's all my take-home message for the participants. Thank you very much.
Thank you, sir. And there are a few questions in the chat box. I will read one after the other. Let me go from the down. Here, there is a question from Mr. Deepalan Dhanapalan. He's asking, if an asymptomatic patient is receiving vaccine, will there be any after effects? Because we don't know whether we have been infected by COVID or not. But then sometimes we may have. So if such a patient takes vaccine, what are the effects or ill effects of that? So I would like Dr. Padma Kumar and Dr. Fetil to shed some light on this.
Yeah, the necessity of vaccine doesn't depend upon the symptoms. Whether the patient or whether the person had symptoms, whether he had infection, whether he had a severe infection, that is not a matter. Everybody has to take the vaccine, because as we have already mentioned, this Gopal sir also has raised this question, whether the vaccine or COVID is better. Means getting a vaccine or getting COVID is better. That was the question asked by him. Because COVID is not always a mild illness. In about 20% of the patients, it can become severe. It can produce various complications also. And also, I mentioned regarding the long COVID issues, because even after the COVID is cleared, the patient is still having issues even after months or even several weeks after the infection. So always we have to prefer the vaccine when it is available to you. Whether you are asymptomatic, whether you are symptomatic, that is not a matter, because even a asymptomatic person can have long COVID manifestations later. So if a vaccine is available to anybody, they have to take the vaccine. And if the person has got some COVID infection, proven infection, he has to wait for at least 2 weeks, because he should not spread the infection to other persons in the vaccination site. So if the person is already diagnosed to have vaccine, he has to wait for 2 to 4 weeks. then only he is supposed to take vaccine. Otherwise, everybody who had a diabetes, who had hypertension, who had any other illnesses, who had any other comorbidities, everybody has to take the vaccine. And as Amar has mentioned, it produces only very trivial, very mild symptoms, and that is not at all an issue. The vaccine phobia is actually created by some social media also, but that is one important factor I would like to discuss today, because we always have to depend upon the reliable source of information. We should depend upon this information from the World Health Organization or Ministry of Health, Government of India or Government of Kerala. We should not go for other false information or misconceptions from social media, because vaccine phobia is created a phobia in our community. Always remember that vaccine is always better than a COVID infection. Yes.
Thank you, sir. And Amar sir, would you like to add upon this? Sir, you're on mute, sir. You're on mute.
I will strongly support what Padmama said. The end is that whether you want a natural infection and go into some unforeseen complications, or have a controlled course of immunity generation by the vaccine. So there the vaccine would be the number one choice. Now, a little correction to what Mr. Gopal sir said. Right now in India, the recipient does not have a choice. It is just like what you have there, sir. What vaccine is coming to the state from the government of India, that only one vaccine will be available in the state at a time. So the public, the recipients naturally have no choice over that. The two vaccines are being distributed over the whole country in different segments and different areas. So the first dose, if they have received vaccine number 1, they will receive vaccine number 1 for second dose. And for those who receive vaccine number 2, they will receive vaccine number 2 for second dose also. But individual people don't have a choice right now. Now, once our production all is ramped up, maybe, and by that time we will have accumulated a vast amount of experience in numbers. That is entire medical population and entire frontline staff like police and all that. By that time, the public will maybe have the choice if it is available, and both are available for purchase or something. But till that time, only one is available here. And anybody with symptoms, mild symptoms and all that, it will not generally cause any adverse problems. Why we say have a person with the symptoms should not do it? Anybody who is already sick, they can have other exacerbations which will then be attributed to the vaccine and create confusion and fear and all that.
Thank you,
what
sir.
What is the herd immunity factor in India? At what level the chain, we can break the chain, herd immunity?
In case of COVID, waiting for herd immunity would be a bit tricky, because the longer you wait, the vaster segments of people get affected. And
no, that is my question. What percentage of population should have immunity to claim that the herd is immune?
Mohar, do you have any latest figures?
Yeah, definitely, Amar. Sir, it was a very important question. About 70% of the people should be infected. And only 70. Maybe either infection related or maybe vaccinated, whatever it may be. This is the level where we can expect a herd immunity in the community. But as Amar has mentioned, that is not a safe practice when concerned with the COVID, sir. Because we don't know the direction of the COVID in a person. It may be mild, it may be moderate, or it may be catastrophic also. We have seen a 30-year-old man developing COVID pneumonia, ventilated, and he succumbed to death. So we know it. So we cannot play with the patients. That is the issue. So always we had to depend upon this other measures like vaccination, than depending upon the herd immunity when we are concerned with the COVID. Yes, sir.
Why I ask this specific question? Because UAE as a country, we had immunization. We have immunized almost 22% of the population.
Oh.
So, as a country, we are supposed to meet the herd immunity level at the earliest. But paradoxically, the number of cases has increased now. We are having 3,600 cases every day now, which is same level of last April, 2020 April. Despite all the efforts by the government and community.
Regarding this increase in the infection, we don't know whether there is some variation in the genetic status or genetic strain mutation.
Yeah, could be.
Yeah, that is another possibility. Anyway,
Yes.
to develop a herd immunity, satisfactory immunity, at least 70% of the population should have adequate antibodies. That is the level.
Yeah.
And
So
regarding
this
the
being a small country, we may be able to achieve that level of 70% by the end of March, February.
Yeah.
So at that time, we will be in a position to say whether herd immunity is a reality or a myth.
Yeah, that is possible.
So regarding the increase in the community, there is only one plain, simple message that has to go down. The amount of carefulness has a direct relation with it. I don't think the general public need to be concerned about test positivity rates and whether the antigen test is sensitive or whether RT-PCR is better and all that. That is better left to the higher level of academics. For the ordinary man in the home or the street, the basic three things: using a mask properly, keeping a distance as far as possible, and keeping your hands clean are the most simple things. There's no technology, no high tech, nothing involved. Only just plain common sense, and that still remains. So that is why we are calling our campaign Back to Basics. 2021 campaign will be Back to Basics. That is the main thing, or 90% of the thing that the common man needs to know and needs to apply in his daily life. The other things, usually, what happened with, as you rightly point out, sir, in Kerala, everything goes for debate. And one can debate endlessly for hours and weeks on end about all these rates and ratios and all that, and still be walking around without a mask. People debate all these things in a crowd without a mask. So that shows how futile the whole thing of discussion is in a public forum.
Some other people are raising their hands.
Yeah.
Please attend to them.
Yeah, sure.
Mr. Deepalayam Dhanapalan.
Yeah, I had asked Deepalayan sir's question. I had asked here. Ratish sir had asked, considering the facts presented, what kind of precautions an elderly person with diabetes or other morbidities can take without much compromise on the normal life? Like, we don't want to compromise on the normal life, but then we know that we are prone for diseases. So what are the any specific? I think we had answered this question, but then again he has asked. Maybe he is looking for some clarity on this.
Yeah, that is a very good question, because in many of our families, we may have persons with comorbidities, or our elderly parents may be there. So what extra precautions they need, that is the question asked. So all these persons are at high risk for developing an infection. All these are high risk people. So we can classify people into mild, moderate, and high risk. So persons with comorbidities, elderly persons, all are high risk persons. So we should actually intensify our these precautionary measures or safety measures in them. As already mentioned, we have to do all these precautionary measures, and we have to intensify, number one, and we have to keep their comorbidities at a normal level. As Prem has mentioned, the blood sugar level has to be kept at a normal level. Blood pressure has to be kept at a normal level. They have to take all the medicines in regularly. All such things have to be done. And also this reverse quarantine-like measures also have to be continued for this elderly. So these are the directions which can be given to them. Thank you.
Thank you, sir. And here there is a question: how can I reduce stress during coronavirus pandemic? Like, though we are infected or not, but there is a kind of inherent stress that gets into us, because we see so many. And even after the discussion, the back of my mind, I feel that there is a huge. Even if I get infected by COVID, or maybe if I take a jab for a month and a half, I have to be still careful about getting the infection or spreading the infection. Or how about long COVID? So this kind of stress is kind of getting onto our head all the time. Here, Arjun wants to know is there any specific way that he can reduce stress? So how do you administer these techniques on your patients when they come to you?
Yeah, this is also another issue. Mental health issues are very important, because while we are discharging these patients, they are asking us regarding their sleeplessness. They cannot sleep properly. They are worried about their future health, etc. It's a natural thing, because COVID is a new infection. Nobody knows regarding the pros and cons of the COVID in future also. So most of the time we will give them proper health education, because in about 90% of the cases it will not produce any after effects. It is only a mild influenza-like illness, like that. We will give health education. And number two, we will advise them to have some breathing exercises, yoga, meditation, etc. That also will give some calmness to their mind. That is another issue. And if they are not at all able to thrive this with their mental problems in future, then they need some counseling or this psychologist to support, or even mental health support they need. But it is necessary only in very few cases. Simple things like mild exercises, good food, then this meditation, yoga, all these things will help them to have a proper mental relaxation.
Thank you, sir. And here there is another question by Diya Krishna. She is asking, will the COVID-19 vaccine work on the new strains of viruses? Because there are so many in different countries, the new strain has come up, and then will this vaccine that is available in India, will that be effective on the new strains?
Okay, Amar is on telephone. I will answer that question. So now we are worried about these new strains of virus from this UK, UAE, as well as from South Africa. But fortunately, this virus have got some mutations in their amino acid sequence. About 10 mutations were so far addressed. But now many of these vaccines, especially this Pfizer vaccine, as well as the Chinese vaccine, are able to tackle these mutations. So at present, there is nothing to worry, and we are able to tackle these mutations as well as the new varieties of coronavirus so far. So at the present status, we are safe, and we do not worry about the mutations. The present available vaccines are effective against this mutant strain also.
Thank you, sir. And Amar sir, would you like to add on to those?
Sorry, Bindu, I missed that question because my own professor of medicine, Dr. Krishnadas, had called me for some doubts, so that is why I had to take up the call. Our own guru is the guru of gurus. Every other state is his student. So such an eminent person calling, I had to take the call. That's why. Could you repeat?
So the question is, will the COVID-19 vaccine work on the new strains of virus? Dr. Padmakumar has answered this. If you would like to add on to this.
So far, yes. My answer is yes. So far, yes.
Okay. Thank you, sir.
You are not present knowledge.
Okay. And here,
I want to add a point to what Dr. Padmakumar was saying. I told that my son got a second infection, and on testing, it was told that it's the same strain. It's not a different strain. I don't know whether the testing has been proper or not. But the same strain is having recurrence. I don't know how it has happened.
Sir,
maybe if it's a second strain, you could have told it's a
we have seen a lot of patients coming again to the hospital with symptoms, and again they are tested. They are turned out to be positive. Regarding this test positivity alone, we cannot say it is a reinfection, because to say that it is a reinfection or a new infection, we have to identify the genetic structure of the virus. It should have a new genetic structure. Then only we can say it is a new virus or a new variety of coronavirus. It is a reinfection. Most of the time, this RT-PCR may remain positive for a long time, because sometimes the dead elements of the virus, it may be some envelope of the virus or some dead remnants of the virus, that can produce a positive reaction. So that may be the reason for a re-positivity. It may not be a reinfection. It's very, very rare. Thank you, sir.
So Mahadevan sir, hope you've got your answer. So let me move on with the other next question.
Okay, please proceed.
Yeah. So Mr. Jagadish wants to know, must we have allergic test before having the vaccine to check the negative aspect? So do we, I know that before answering, I know that we are past the time that we were planning to fixed was 4 to 6, and now it is 6. I want to ask the guest, do you have enough time to spend to answer this question? There are 2 more questions, so would you have enough time to answer, or should we wind up?
This is an important question, so shall I answer that in 1 minute? Allergy, the word allergy is used wrongly often. Allergy means unusual severe reaction to ordinary substances. So that is so far in one's life, if one has such a tendency, it will be well known to some drug or whatever. Things like falling sleepy, feeling sleepy, or things having a tummy upset after a drug, those are not true allergies. So there is no need to have if you have an allergy by now, you will know it that you have some allergy. Otherwise, there is no need to take any specific allergy test before going in for vaccination. It is not recommended.
Thank you, sir. And here, Hardi is one of our staff. She was again a COVID survivor. So she has a question. What is the chance of getting COVID positive twice? Like same question like Mahadevan sir asked. Unless it is another strain, same strain, it is not possible for the same strain to happen, right? That's what you would want to know. Let us know.
It's a difficult question, and it is difficult to answer also, because we don't know whether the same virus can produce a reinfection, because we don't know how long this antibody will persist or antibody will survive, the quantity of, isn't it, Amar? the quality of the quality of the protection that is conferred by the virus infection, we don't know. So that is why even after the infection, we have to continue all the measures of protection. So the vaccine or this infection will never prevent us from using all these protective measures. That is the message we have to convey. We don't know how long this immunity continue persist. Yes.
Thank you, sir.
Bindu, this is because this is a quite new disease. The disease itself is only 1 year old. So it's too early to make out rules and positive conditions. It may take years, at least 1 decade, to establish certain rules.
I understand. And now there are so many questions, but then I am not moving on because it's already 10 minutes past the time. And I know that all of you are so busy and you have taken this time to spend with us and answer all our queries. And you have made things so simple. You have explained things so very well. Yes, but for us to be responsible, I don't know, maybe we have never been responsible in life. All of a sudden in 1 year, you're asking us to be responsible. So that civic sense, lack of civic sense is a hindrance here. Maybe we will have to train ourselves. Hope we will be able to do that. And I will move on to the official vote of thanks here. But
can I make a point?
Oh, sure, sir.
Right, there are so many people with so many doubts. Many of those doubts are very, very real doubts. So I offer a solution. Anybody with any kind of doubt, whether major, minor, whatever, you can call up our information service or helpline called Disha, D-A-S-H, Disha. And the number, I will give you the number.
Okay, sir. I will put it in the chat box. You can read the number. I will.
0471
0471
255
255
2056.
2056. So Disha, it is 0471 255 2056. Okay.
I would request everyone to please save this number on their phones, because this you will need for, it's not only for COVID, for any kind of health situation, for any kind of health emergency, for anything to do with health, even to know the number of any official of health department, anything and everything. This number you can use. For emergencies, you can call throughout the night, even 1 a.m., 2 a.m. doesn't matter. You are welcome to call. You can welcome your call even at 2 a.m. in the midnight. No problem. But for doubts and other things, just for getting information, please restrict your calls to say between 9 and 5 or something. There are so many doctors who take duties continuously and still answer calls. So please call for any emergency. Don't be hesitant to call. But for information, doubt clearing and all that, please call during the daytime. We welcome every single call.
Thank you, sir. Thank you very much. And actually, I would like to take this opportunity to thank all the health workers, their bureaucrats, the administrative staff, the government. Though people are a little irresponsible, you have taken all the efforts from your side to keep this whole pandemic in check. So hats off to all of you. All the doctors, all the health workers, all the bureaucrats, administrative staff. You have been working day in and day out to protect us. So you guys are equal to any soldier who's protecting the borders of the country. Thank you all for spending that much of time for taking care of our health. Mahadevan sir, would you like to add anything to this discussion, or shall we go on with the vote of thanks part?
Because we have got another meeting at 7, it's advisable to wind up. One meeting is there.
So I will go on to the official vote of thanks part. I take this opportunity to thank our chairman to be with us during this session and shedding a lot of light happenings in UAE, and also comparing that with what is happening in India and giving us a lot of insight from his side. Thank you, sir. And now I take this opportunity to thank Dr. Amar S. Fetil in spite of his busy schedule. Whenever I call him, we say, Bindu, I'm in a meeting, I'll call you back. But in spite of all that, you have spent this 2 hours with us. Thank you very much for that, sir. And henceforth also, I will take all the opportunity to trouble you, so please be prepared. And I thank Dr. B. Padmakumar, sir. You are almost all the time. Only between 1 to 2. That is the time I get some breather. And I always, I think I have kept that schedule. In fact, thank you very much for spending this time with us. And next, I would like to thank Dr. Prem Narayanan for spending his valuable time and discussing about the issues, that endocrinology issues that COVID could cause. Thank you, sir. And next, my beloved colleague, Professor Roshan Sanu. He has gone through a lot of, he has not faced a lot of difficulties because of COVID, but then COVID brings a lot of scare also. So he has gone through that, and when his parents also fell ill, he had to go through a lot of emotional and physical stress, but he faced all that, and he's a fighter. So he has come victorious, and he's back with the tribe now. And now, next, I would like to thank Director, Ahalia Group of Academic Institutions, Dr. P.R. Mahadevan Pillai. Any ideas we pitch, that he'll say, go ahead and do it. And he was the one who actually all of you. Whenever I say that I would like to do such a session, do you have any? He has all the people on the fingertip. So he gives us, he gives a lead, and then where we contact, and that's how we got such good resource people in this discussion. And you are the backbone of the success of this discussion. And thank you very much, sir, for being so supportive. And you are actually the backbone of the academic institutions. So it gives us courage to go ahead and do things. And next, Dr. Krishna Kumar Krishore, he was there in the beginning of the meeting. I think now he has logged off. KK sir was always supportive, and though he's a very analytical person. If you pitch any idea, he will see the pros and cons and the workabilities of that. That makes us think whether the ideas that I'm going to pitch is workable. So thank you, sir, for being that supportive to us. And next is all the staff and students of Ahalia Group of Academic Institutions, especially Professor Lakshmi Suresh and Professor Prija, for supporting me throughout this in organizing this event. And all my students, I misspelled Anugraha's name. I'm sorry for that. Students Anugraha, and then Arjun, and see, this is what happens with me. And Nitishri, all of them. I contacted them in the morning to introduce the guests, and they readily came forward. They're first year students. They don't have any, they're not jittery, and they confidently came forward and said, yes, ma'am, we will introduce them. They're confident. So that is the kind of students we have in Ahalia Group of institutions. Thank you, students, for being so supportive. And now I thank all the participants for spending this 2 hours and 15 minutes with us. And I will inform all of you regarding the next happenings of Ahalia Forum, and hope to see all of you back in our next panel discussion also. Thank you very much for being with us. Thank you. And
I think we can close with a message from our chairman.
Yeah, yes, sir. We'll be glad.
I would like to have a closing message to all our participants.
Sir, Chairman, sir, a single sentence punch dialogue from you. No, I don't think. I think he's.
I already conveyed a take-home message with regards to COVID and management and the future outlook towards the vaccination. I think that is enough. We'll see next time.
Sure. Thank you, sir.
Okay, thank you.
And thank you all the guests for being with us. Thank you very much.
Thank you.